patient in his mid to late 80s presenting symptoms of benign prostatic hyperplasia, which is an enlarged prostate gland in men caused by an excessive growth of epithelial and smooth muscle cells in the prostate gland. Our patient specifically presents a higher ratio of epithelial cells in his prostate. This is causing mechanical obstruction on his urethra. His symptoms include urinary hesitancy and urgency, increased frequency of urination, dysuria, straining to void, and sensation of incomplete bladder emptying. The physician on this case has ordered a prescription for Finasteride, a 5-alpha reductase inhibitor. We will now educate the patient on this drug.
Okay, so we have spoke to your physician and he's prescribed you Finasteride for your BPH. I'm just going to go over the drug with you and make sure you understand how it works. So Finasteride inhibits 5-alpha reductase, which is an enzyme that converts testosterone to dihydrotestosterone, or DHT, which is its active form. So Finasteride is going to decrease DHT levels, leading you back to your normal prostate size by allowing epithelial cells to regress back to their normal levels. Okay, so I'm just going to go over some side effects you might encounter, which include decreased ejaculation volume and libido. Gynecomastia does develop in some men, and this is teratogenic in the male fetus, so if you do encounter any pregnant woman, make sure they do not handle the drug because it can be absorbed through the skin. And this also leads to an increased risk of prostate cancer, so we're going to check your prostate-specific antigen, or PSA levels now, and then in 6 months, we'll check your PSA levels again.
Okay.
And one thing to note is that this drug does take about 6 to 12 months to see like a result, so just be aware of that.
Okay.
Okay, do you have any questions before I go?
No.
Okay.
Thank you.
So this is important for a nurse to know because it does occur in about 50% of men by the age of 60 and increases all the way to 90% of men by the age of 85.
Because this is such a prominent disease in men, it is important to be knowledgeable on the topic in order to improve patient care.
So this is important. Wait, I don't know if this go. Finasteride for your D85.
Because this is because this is such a common disease in men, being well knowledge on this topic